So metaplasia, again, that's where a cell changes into a different type of cell. It can happen due to repeated damage to epithelial lining or vitamin A deficiency. Like keratin appearing somewhere it shouldn't be. Dysplasia is abnormal tissue formation. Can be a precursor to neoplasia. Epithelial dysplasia can. Atypical features of cells. They vary in size, shape, and in mitotic activity. They're disorderly arranged. It can happen due to stress, like stresses on the cell, inflammation, irritation, due to smoking or UV exposure. It's often considered pre-cancerous. The difference between metaplasia and neoplasia: metaplasia is not malignant. Metaplasia is an indicator of potential damage to the area. It can progress to dysplasia, and dysplasia can progress to neoplasia. Neoplasia is benign or malignant. Cells don't respond to normal growth or inhibitory signals. They've got abnormal genes, and they have a clonal population. They're just clones. They're all clones. That's why tumors happen. All right. And a bunch of quiz. How are cells injured? Well, they can be injured via oxygen deprivation, which is hypoxia, ischemia, or anemia. They can be injured via physical agents like trauma, burns, frostbite, electrocution, radiation. Or they can be injured chemically by toxins or drugs. They can also be injured via nutritional imbalances. Not enough vitamins, not enough minerals, not enough proteins. Genetic mutations, immunologic dysfunction like autoimmune disease, hypersensitivities, or infectious agents, bacteria, viruses, fungi, parasites. Cell injury happens because of depletion of ATP, mitochondrial damage, calcium imbalances, accumulation of reactive oxygen species, defects in membrane permeability, and damage to DNA and proteins. And there's a lot of, you can go into this in detail. Hypoxia. So an oxygen-poor situation results in failure of ATP-dependent sodium-potassium pumps, which results in the cell swelling. It results in anaerobic glycolysis, which leads to intracellular acidosis, which leads to dysfunctional enzymes. It results in failure of calcium pumps, which leads to calcium influx, which results in general cell defunction or dysfunction. And it can just cause the cell to die. It's just not going to live without oxygen. It can also, depletion of ATP can also result in mitochondrial damage. In oxygen-poor situations, it's going to generate reactive oxygen species, which are not good. They're not healthy to have a lot of those in your body. Yeah, that's all we talked about in general pathology. Moving on to next we had physiology and histology. So let's see. All right, kidneys, water loss. The kidneys are the most important regulator of water and electrolyte balance. If you have a decreased water excretion, it's because you're dehydrated. And if you have an increased excretion with increased intake, well, I mean, I just gave it away. You know, your secretion increases whenever your intake increases. A decreased water excretion doesn't always necessarily mean dehydration, I don't think, actually. So it could be because you're taking a diuretic or an anti-diuretic. Diuretics make you pee more, anti-diuretics make you pee less, probably. And diuretics come in the form of coffee. Hey, Hannah, how are you doing? Coffee, alcohol like beer, booze, any kind of alcohol. But yeah. The excretion rate matches intake and disease state. I'll show you guys a picture here. A urine color chart. You want to be near the top and you don't want to be near the bottom. I don't know how well you guys can see that, but I'm doing well, Hannah. It's good to talk to you. Some factors that influence water loss are the ambient air temperature, solar and thermal radiation, humidity, solutes and wastes to be excreted, the amount and timing of physical activity, the amount of water intake, and physiological, behavioral, and anatomical adaptations to reduce water loss. So your body can adapt very simply, and it does that in order to reduce water loss. For example, living in Arizona versus living in Baton Rouge, Louisiana. All right, Hannah, have a good day at work. See you later. You're going to have a humidity difference between Arizona and Louisiana. Arizona is very dry. You're probably not going to sweat as much. Louisiana is very humid. You're going to sweat a lot. The reason why is because Arizona, your moisture that you sweat is probably just going to get immediately wicked from you. Whereas in Louisiana, the air already has a lot of humidity, and so that moisture just stays on you. Kidneys control solutes, and if you ever feel thirsty, you're already dehydrated. It's just good to know. There's something called insensible water loss, which is water lost through the skin and the lungs. You don't even feel it. It's evaporation. It's just gone. It just leaves. It's different than sweating. Burn patients have increased water loss by this mechanism, and patients with open wounds have the same issue because your skin just doesn't have that barrier anymore. You lose a lot of weight just by sleeping. I am not an actual doctor yet. I'm in my first year of vet school, second semester. 3 more years to go after this, and then I will be a veterinarian. But thank you for that question. It was a good question. But yeah, you just lose pounds of weight just by sleeping because of that insensible water loss. Just breathing makes you lose water. That's why we need to drink water so often. It can be challenging for the body to get water into the body. Okay, so because water has to cross the capillary membrane to get into the capillary, and then it has to cross the cell membrane to get from the capillary into the cell. before that water is intracellular. And intracellular water is what we need. How familiar am I with cat psychology and off behaviors in a cat? Well, I'm a little bit familiar with it. Any concerns in mind? Do you have any concerns? Osmosis is the only force that drives water in and out of the cell. Okay, we've got extracellular water, intracellular water, transcellular water, or fluid, like cerebrospinal fluid, intraocular fluid, fluid in the GI tract, and potential fluid. This is fluid in the peritoneum or in joint spaces. But water is like 50 to 60% of our body weight. So it's very, very important. It decreases with age, and it varies with gender, and it can also change with obesity. Intracellular water is about 40% of body weight, and it's similar in different species. So, using bathroom out of the litter box without any dramatic change in environment, no new people, no identified causes of stress, things like that. Cat's been getting a little odd with it. What kind of cat do you have? Is it male or female? And is it intact or neutered? What I mean by that, does it have its, if it's a male, does it have its testicles? If it's a female, does it have its uterus? If so, then female neutered, okay. Are there any other cats in the house? If there, okay, no other cats. How old's the cat? Extracellular water is about 20% of the body weight. But intracellular water, again, is the most important. A raccoon that typically comes by, but she's an outdoor or indoor cat. She's about to be 8. Okay, so not well, so age can definitely be an issue eventually, but your cat seems to be pretty fine. I have similar experiences at home back where I live, or back where I came from before college. We have about a 7 to 8-year-old cat. He just pees, or he used to pee everywhere. We had to just put up baby fences and stuff, baby gates and stuff like that. I don't. Are there any like any other behavioral issues that seem to be being affected in your cat? Like, I don't know, any signs of cognitive decline, perhaps? Because that could be a reason why they'd be peeing everywhere. Or, like you said, the raccoon could be the problem. The cat could be feeling threatened, maybe, and so nip at herself on one spot, constant scratching, very skittish at times. Well, no fleas or anything, and has been treated, but I'm thinking it could be the raccoon too. Yeah, that's my best advice. Again, I'm not even like a veterinarian yet, but I've my you know my I've been around a lot of veterinary stuff, and from what I can tell, I mean, we have a cat that does the same thing. We think it's seasonal allergies for the scratching, but it could just be autoimmune stuff. Could just be, I don't know, random inflammation. But for the behavioral issues, peeing all over the place, I'm thinking it's probably because of the raccoon. That would be my best guess. I mean, I'd have to see your cat, or like any veterinarian would have to see your cat in person, um, in order to figure out the real problem. Because I mean, you can find out so much from a physical exam. But for the behavioral issue, I'd say it's probably the raccoon that is making your cat feel threatened, and so the cat's peeing all over to sort of establish a territorial thing, right? Trying to mark its territory, or mark her territory. And so that's what I would say. But I'm not 100% sure. Hopefully that helps. I don't know. I don't know any solution really to be able to fix that, because it sounds like that raccoon just comes around. But thank you, Asa. I hope I said that right. Yeah, thanks for asking that question. That's a good question. So plasma is another important part to liquid in our bodies, or in the bodies of an animal. Plasma has a higher protein concentration, and there's something called, I am not a doctor yet, but I am in vet school. I will be a doctor in 3 years. I'm in my second semester of my first year. So I know a little bit, but not everything. The Donnan effect is the extra osmotic pressure due to the presence of proteins. So just having proteins in an environment in your body contributes to osmotic pressure. Hematocrit, PCV, packed cell volume. That's one way we measure, or that's one way we evaluate blood. Erythropoietin is a hormone released by the kidneys that increases red blood cell count. And for example, lung disease can trigger the production of erythropoietin. I don't know if you guys heard about Lance Armstrong, but whenever he was doing the Tour de France, he basically got past doping authorities for a bit by doping with erythropoietin, which increased his red blood cell count, which increased his oxygen capabilities. Vet for racehorses? Me? No, I'm not. Are you? I'm not. Is that a question? I'm not sure. I'm not planning to be a veterinarian for racehorses, but I want to be knowledgeable. I want to be able to consult. Lung disease can trigger. So, and all the species of animals have different PCVs, packed cell volumes. And there's even a difference between men and women, humans, right? A low PCV in severe anemia, which can be caused by hemorrhage, it can fall to like 10%. That's pretty low, not good. A high PCV in some things like polycythemia, I don't even know what that means, I'll be honest, but that can rise it to 65%. I don't know what that means yet. I'll probably know eventually. Chronic obstructive pulmonary disease, again, raises erythropoietin in response to hypoxia. Erythropoietin goes up, Red blood cells go up as a result, and then oxygen capabilities also go up. For example, if you climb Mount Everest, when I'm a veterinarian, will I operate on all animals or specific animals? I'm thinking, well, where I plan to practice is going to be small animals, but there might be opportunity to turn it into a mixed animal practice eventually. I want to be able to consult on all animals, though, and I want to be able to work on all animals. So I'm looking forward to that for sure. But you climb Mount Everest, your PCV will increase because your body's going to produce more erythropoietin to increase red blood cells, to increase oxygen, because the air is very thin up at the top of Mount Everest. Extracellular sodium is an extracellular cation, and chloride is an extracellular anion, very common. Potassium is an intracellular cation, and phosphates and protein are very common intracellular anions. So sodium and chloride are high outside the cell, and potassium and phosphate or organic anions are high inside the cell. All right, just a bunch of stuff here. Basically, the thing to know about osmosis is that water is going to follow the salt, okay? So if you have a selectively permeable membrane here, you have a lot of salt over here and a lot of water over here. That water is going to go through that membrane over to this spot to equalize, right? Plasma and interstitial space, intracellular and extracellular forces. These are all things that impact fluid distribution. Hydrostatic and osmotic forces. Osmosis is probably the biggest one, but water is always going to follow the salt, basically. If you eat more salt, you're going to need more water. It's the same mechanic. An isotonic solution will not change something, or will not change the size of a cell, because it's going to be the same osmolarity as the cell. A hypertonic solution will shrink the cell because there's more salt outside of the cell, and a hypotonic solution will swell the cell because there's less salt outside of the cell. And that's it for physiology yesterday. Next, moving on to comparative anatomy. So we started off, goodness gracious, okay. Yeah, textbooks, okay. We started off talking about the neck, okay, the neck and the head. So what is the pole and the withers of a horse or a cow? So the pole is the topmost part of the head, basically. The withers is the topmost part of the shoulder. In the horse, it's the nuchal crest on the skull. And in the bovine, or the cow, bull, whatever you want to call them, it's the intracorneal protuberance, I think. I think that's what it was. I couldn't exactly understand what he was saying all the way, but now in horses and in oxen, the cervical vertebrae are slightly different, but still pretty much the same. However, the orientation within the neck is universally pretty much the same. It's in the middle, right? The vertebrae are in the middle. And so you don't want to hit the vertebral column during an injection, like an intramuscular injection, any sort of injection. Now there's ligaments and bursae, like the nuchal ligament. In the dog, it goes from C2 to T1, so the axis to the start of the thoracic vertebrae. But in the ox, or the bovine cows, it starts at the skull. The nuchal ligament does. It starts at the skull and goes to the thoracic vertebrae as well. It has the nuchal ligament in the ox has a funicular part and a lamellar part. I'm not exactly sure what those mean, but that's just what they told us. Those are the two parts in the horses and the cows. All right, in the horse, there's the caudal nuchal bursa and a cranial nuchal bursa. There's also a supraspinous bursa. Those also might be in oxen, but I'm not sure. Bursas are filled with synovial fluid, remember that. And bursitis is when that bursa gets infected. There might be pus in the bursa instead of synovial fluid, or pus in addition to synovial fluid. Now there's plenty of muscles, and this is probably the hardest part. But there's a lot of things that are the same, and there's some things that are different from when you're comparing oxen and horses to dogs, okay? Dogs and cats. There's extrinsic forelimb muscles, hypaxial muscles, epaxial muscles. Hypaxial and epaxial, those are going to be on the back. And then there's cutaneous muscles, okay? Superficial and deep. They still have a trapezius, same as a dog and a cat. They still have a brachiocephalicus, same as a dog and a cat. Trapezius, remember, those are the triangle-shaped muscles. For us, it's up here. These are our traps, right? For animals, I guess I'll just show this to you. The blue, the dark blue, that's the trapezius. Right there. So there's more though. There's the omo transversarius. On the dog, it was a lot different than on cattle and on horses. Horses and oxen have they've got very, very complex neck muscles. They have a splenius just like the dog. The splenius is epaxial. They have a rhomboideus just like the dog, rhomboids. They have traps, trapezius just like the dog. But then you get to these front neck muscles. There's the omohyoideus, there's the cleidomastoideus. And so these, again, I'm starting to get into the parts of the brachiocephalicus. The cleidomastoideus, omotransversarius, serratus ventralis, and the cleidobrachialis are all kind of in the same area, and these are, I wish, I guess I can show the picture. It's not very good, but technically these pictures are not mine, so I shouldn't show them, but it just helps. I know all the words are probably backwards, though, so that's not... Are they? Yeah. Looks like they are. But it's very, very... I'm glad you guys don't have to learn this, because this is complex stuff. I'm going over this to teach anyone who wants to know as much as I can teach them. I don't really have good materials, but... Or not that I can... Anyway, my main purpose of doing this is for me to review, but I want to talk to you guys and teach, so a little bit. But it's different in the ox, the muscles are just slightly different. The cleido occipitalis is a new one. These muscles are not fused with the omotransversaris anymore, as they were in the horse. So again, then there's the deep neck muscles. There's the omohyoideus, the sternomandibularis, which is the same as the sternocephalicus in the dog. And then there's the ox. It has the okay, sorry. So the sternomandibularis is part of the sternocephalicus. Now in the ox, there's the sternocephalicus muscle, which has two parts, the sternomastoideus muscle and the sternomandibularis muscle. Same as in the horse, pretty much. Okay, and then in the dog, we had the sternocephalicus, sternohyoideus, and the sternothyroideus, right? In the horse, we have a little bit different, or we have it a little bit different. There's the omohyoideus, the sternothyrohyoideus, which is the sternothyroideus and the sternohyoideus combined. And then you have the sternomandibularis. That's mandibularis. It has to be. It's just a typo. Yeah, very, very weird stuff. But yeah. Anyway. If you're doing a jugular vein blood draw on a horse, then it's pretty simple. They've got a little groove that you can see in between their brachiocephalicus and sternomandibularis, I believe. Could be wrong about that. But all the muscles are pretty much the same. They have a carotid sheath, which has that artery. You do not want to get into that carotid sheath when you're doing a jugular blood draw. That would be bad news, at least for your purposes. Anyway, the jugular groove, this is what we were talking about. It's pretty visible. And then intramuscular injections. So the jugular groove in the horse, the dorsal border is the clitomastoideus. Okay, so this is setting the story straight. The ventral border is the sternomandibularis. And then the deep border is the omohyoideus. In the ox, it's all the same. The dorsal border and the ventral border are the same, except for the deep border. The deep border in the ox is the sternomastoideus. So a little bit different. And there is a muscular layer separating the carotid sheath and the jugular veins in horses. So you don't have to be too worried about a jugular blood draw. For intramuscular injections, it's pretty simple. There's like a triangle area on their neck that's very safe to, do a injection. You just got to be careful not to hit any important blood vessels, and you'll probably be good. I mean, it's, again, small needle, relatively small to their size. You're not likely. It's such a big area. I mean, they're large animals, horses. So you'll probably be fine. And once I learn more, I'll try to convey more. But that was it for comparative anatomy. Next, we had CCC, which was very cursory, very almost unimportant, I'd say. I don't know. Let me try and find that there. So, yes, I'll go ahead and end this and do part 3.